Hi, I'm Dr. Sally Bell. I'm a mum of 3 girls and I've been a medical doctor for 20 years, and I'm a GP that specialises in lifestyle and functional medicine. And at the moment we are facing the issues with the coronavirus as a nation. It's touching every family and every community around our nation. And I wanted to talk about the things that we can do to boost our immunity and our ability to fight off the infection. Now, these videos are to go alongside all the great advice that the government is coming out with, the importance of hand washing, the importance of isolating yourself when asked to do so, and the importance to stay away from large gatherings. However, there is so much that we can do to help boost our own ability to fight off the infection when we get it. I mentioned yesterday in my last video that the key things, the key foundations that underpin our health include sleep, rest, movement, nutrition, and connection to self, connection to each other, and connection to that wider sense of purpose. And today I wanted to mention about sleep and the importance of sleep. Like when I trained as a doctor in the 90s, we didn't understand at all why we slept. And the science around sleep has just been phenomenal over the last 20 years. And it's certainly my understanding and my growing understanding of what happens in our bodies when we sleep is one of the major things that I use when I'm treating my patients, and has really shifted how I work as a medical practitioner. And sleep, when we sleep, a whole host of things happens in terms of repair to our body. As well as other things in terms of our creativity, our ability to learn. There's certain parts of our sleep that when our emotional health resets, we know that when we don't sleep, we're more at risk of obesity. So actually it's so hard to lose weight because of the sort of hormonal imbalance when we're sleep deprived. We know that when we don't sleep as much, it significantly increases our risk of heart disease. It increases our risk of diabetes, it increases our risk of cancer. And in this discussion, as we're talking about combating an infection, it has a significant impact on our immunity, on our ability to fight infection. And we know that if we sleep consistently less than 6 hours a night, it reduces all those little soldiers that we have that fight off infection in our body. It reduces the number of those and the types of those so that we cannot fight infection effectively. And actually, there's some research that shows even just one bad night's sleep can have a significant impact on your immunity and make you more predisposed to picking up an infection the next day. So I want to put into your hands the importance of sleep, how potent it is, and how it is just a great a weapon that we have in fighting infection and fighting disease. Now, for some of you, and I think for a lot of people, they don't realise this, and it's just a matter of prioritising it. Like they literally just need to go to bed earlier. We need to ask the question, how much is enough sleep? And it's recommended somewhere between 7.5 and 9 hours asleep, not in bed, asleep. And in order to work out what's best for you, you need to ask questions like, do I feel refreshed when I get up in the morning? Do I need an alarm clock to wake me up? Do I need a cup of coffee to wake me up? Because if we need those things, it's suggestive that we're not getting enough sleep. But then, there's those that just need to prioritise it. But then there's those people, especially the elderly and those with pre-existing conditions, really struggle to sleep. I'm one of those people that the first thing when I am stressed, my sleep goes. And I have to work really hard at getting good quality sleep. But there are lots of things that we can do to help us get sleep. And I'm just going to run through some of them. There's a lovely summary on my website, and if I can find somebody technical enough, I'll even manage to put the PDF on my YouTube channel, where there's, under the resource section, there's this sheet here which is all about our sleep hygiene and you can download that with some ideas of what you can do. And sometimes you need to do all the things that I'm going to talk about, and sometimes you just need one or two. So the key things that when I'm teaching people to sleep is taking caffeine out of their diet. We now understand that caffeine directly opposes that sleep urge and that ability to sleep. And caffeine, which is found in tea, coffee, green tea, Coke, pop, it can last in your body for anything from sort of 6 to 12 hours, depending how easy it is for you to get rid of it. So the first thing I do is get caffeine slowly and gradually out of people's diet. If you're on 10 cups a day, don't go cold turkey. You'll think you've got the coronavirus the next day because you will have a stonking headache. So gradually reducing your caffeine intake and replacing it with water or dilute squash if you have to. The next thing is getting a really good routine. Go to bed the same time, get up the same time, because your body runs on clocks, and we need to tap into this. After that, I suggest getting outside. Even if you're supposed to be socially isolating, you can stand on the back doorstep and get some sunshine, because we know as we get exposed to the sunlight, it suppresses our sleep hormone, which then bounces back up later in the evening to help us sleep. And then exposure to light later in the evening, especially from our phones and our TV and our lights. This suppresses this sleep hormone that I've just spoken about. So cutting out screens a couple of hours before you go to bed can be really helpful. Or if you really have to work on a laptop, using your night setting, or even getting some blue blocker glasses that you can get from Amazon to help block out that blue light. Other practices that might help is having a hot bath, journaling to get your mind quiet before you go to bed, some breathing or some meditative practices to help reduce that stress, because stress really opposes our sleep and disrupts our sleep. Our bodies also need to be really cool when we go to sleep. Our bodies need to drop about a degree, and that helps us get to sleep. So making sure your bedroom's cool, making sure it's dark, making sure it's uncluttered. And then finally, if you find that you're lying and tossing and turning for 20-30 minutes, to get up, to leave the room, to find a book to read, something that doesn't include screens, waiting till you're sleepy again, and then returning to bed. And if we do all of these things, we can train ourselves to get better. And sometimes, like I said, we might need to do all of them, and other times we might just need to do one or two of them in order to get that great sleep. But I cannot tell you and express the importance of how fundamental and foundational sleep is to all of our health. So sleep well tonight, and look out for that resource on my website, drsallybell.com. Thanks.